going to talk about is a labral tear in the hip joint. So inside this hip joint, we have that ball that went into that socket. Inside the socket is a piece of material that lines that socket, and that's called the labrum. The labrum is super important because it is the key to provide shock absorption into your hip joint. And what I mean by shock absorption, it means it allows your body to absorb the weight through the ground when you're in an upright position. Without that labrum, you will not be able to do those activities at all that involve a lot of shock absorption. So what happens with a labral tear is that it can occur when there's a lot of wear and tear over time. For instance, when you're pretty active doing activities such as soccer, that can easily cause a piece of that labrum to tear. And when that happens, there's not a lot of good blood flow there, so it cannot completely heal on its own. The other way you can get a labral tear is if you have an impingement, which we mean by taking that femur bone, which is the ball bone, into the socket. So normally that femur should be centered in that socket correctly. And the problem becomes an issue when that bone is not sitting centered in the socket. It starts to kind of ride forward. Some people are born with issues of the hip and don't even realize it, and so that femur's not sitting correctly already from the beginning. However, over time, sometimes that ball, because of poor mechanics of that femur inside the socket, can occur. That ball starts rubbing and rubbing and rubbing the front of that labrum, and when that happens, that just wear and tear over time ends up tearing the labrum. So the thing to know is if you play sports, especially soccer, anything where you cut and twist, be mindful of that. And if you experience pain, what you're looking for is pain that is in the front of the thigh area, inside the groin, occasionally also pain on the outside. If you hear any clicking or popping or catching when you try to move your hip, even walking up and down stairs, sometimes people feel like the actual joint catches and they have to kind of get past that point. The other big sign is if you actually take your hand and you all try to grab the hip joint like this because you feel like it's a deep pain inside the joint, that can be indicative of a labral tear. So what do you want to do if you have some of those symptoms? Well, first of all, you kind of want to decrease your activity level at the time, because only continuing your activity will make it worse. We can assess you when you come in for physical therapy and let you know what we think. For most people, you can easily do physical therapy to help you with strengthening anything around the joint to give that joint support. If it's a small tear, a lot of people don't need surgery. And if you have a tear and you're a little bit older and you're not looking forward to getting back to sports, you also can avoid surgery. We can give you the tools you need and the specific exercises you need in order to strengthen all those muscles around the hip so that it can give that joint the support it needs.